The subject of my presentation is epidemiological characteristics and factors contributing to the development of liver fibrosis in HIV/HCV co-infected patients in Ukraine. Ukraine has faced with rapid growth of HIV/HCV epidemics. These diseases are a real concern not only for Ukraine but for many developed countries. Ukraine distribution of epidemic is seen to be fueled by the people who injected drugs with limited access to antiviral therapy of HCV infection. The aim of study was to analyze the epidemiological characteristics of a cohort of HIV/HCV co-infected patients. We have examined the contributing factors of accelerated fibrosis progression in HCV and HCV co-infected patients. Patients' baseline characteristics are shown in table. In the group of HIV/HCV co-infected people, a significant prevalence of males, age group 30-39 years, with parenteral route of transmission was recorded. In-depth analysis of epidemiological characteristics has allowed us to detect that negative tendency of recent years was the increase of sexual transmission significance of HIV infection. The clinical findings and immune state of HIV patients have been analyzed. Late HIV infection has been established to occur in the group of HIV/HCV co-infected people. Also, nadir CD4 cell count has been significantly lower in the patients with HIV/HCV co-infection. Survival analysis has proven the presence of genotype glycine 11 glycine TLR7 gene to be one of the factors contributing to the development of liver fibrosis, along with other factors like age over 40 years, male sex, and presence of TB infection, and CD4 cell count below 500 cells. So, in conclusion, the study has revealed a significant prevalence of male patients of reproductive and able-bodied age with the parenteral route of transmission in the group of HIV/HCV co-infected people. A higher risk of accelerated fibrosis progression has been seen in HIV/HCV co-infected patients with older age, male sex, lower level of CD4, presence of TB, and genotype glycine 11 glycine TLR7 genotype gene. Thank you for your attention.
Thank you very much. A very impressive, large number of patients you looked at. And my question would be, because I didn't get it that fast, the CD4 count, was that the current CD4 count, or did you also look at CD4 nadir?
First of all, when a patient admit our clinic, we perform CD4 cell count nadir CD4.
Oh, so these were the nadirs?
Yeah.
Okay, very good.
A lot of patients have a late stages of HIV infections, therefore a lot of them have low CD4 cell counts and a lot of opportunistic diseases in our patients. All those patients are in my hospital, in Poltava Regional Center of HIV Prevention and Control. 1,500 patients are receiving antiretroviral therapy.
Okay, good. Corinne?
Yeah. Can you tell us a little bit more about the impact of TB on fibrosis progression? I asked you the question yesterday, but then you can answer to everybody. And then the second question would be, what do you know about this TLR7 gene polymorphism in the implication of fibrosis progression?
Thank you very much for your question. First of all, in Ukraine, TB is most common opportunistic infection in our patients. Therefore, a lot of them have TB co-infection, and they are given anti-TB treatment. Therefore, it can have negative influence on fibrosis progression, because the duration of this treatment sometimes takes a long time, because a lot of multi-drug resistant TB are occurring in Ukraine. So therefore, it's a big problem, and these patients must take a lot of drugs during a long period of time. And regarding TLR7 polymorphism influence, we have another poster that can introduce my colleague, and therefore it's really interesting. Tim?
Is it in comparison
Maybe
to
you can add
the leucine? Is it the GLU11 glue versus GLU11 leucine? What is the comparison?
Please repeat.
You showed what was the polymorphism, what was the amino acid change?
Yes, in our academy, we investigated toll-like receptor 4 and toll-like receptor 7 polymorphism influence on HCV and HIV progression. And these findings allow us to understand that polymorphism of TLR4 receptor can have negative influence on progression of HCV. But in TLR7, it depends that polymorphism is not have this negative influence on progression.
But
Maybe you can
what's the wild type?
Yeah. My colleague from Ukraine has another presentation about TLR7 receptor. So.
Okay, my name is Tatyana, and we have interest in research in our academy, and really we seen today the information about TLR7 receptor agonist for treatment hepatitis B, and now we have the data because gene of TLR7 is improved to produce of interferon, and maybe it is deal with progression of fibrosis among these patients.
And do you know what the polymorphism is?
Yes, but polymorphism of this receptor have protected role, but normal genotype of this receptor is like predictors of progression of fibrosis.
So is the normal genotype glutamine or leucine?
Yeah. Which the data, our data and data other researchers is about the lower interferon produced among these patients.
I see. Okay.
All right. Any more questions? I think then we'll move on. Thank you very much.